Assalamu alaikum warahmatullahi wabarakatuh. I hope all of you are doing good wherever you are. In today's head to head program, we'll try to understand one of the burning issues which is in the Jammu and Kashmir, obviously, that's related to the healthcare and the enormity of the challenges that we try to understand in this sector. The shortage of the doctors, the shortage of nurses, the shortage of the equipments, the CT scan, dialysis, ultrasound, all these kind of machineries, which are being often provided in some of the hospitals, but we don't have skilled trained staff which are able to, operate these kind of machines very much fairly. So we need to really understand if the results the doctors are being given without proper accuracy, without 100% reliability, how the doctors will be able to diagnose those patients. So we'll briefly try to understand as to the major challenges and the gravity of the challenges and the magnitude of the challenges which are there in the healthcare sector with the support of some of the figures, some of the database that we have that we collect from different sources, and what are the ways and means with the government in the timely deadlines, when they'll have to have the extensive discussions, extensive debates, consultations, and the experts from the concerned industries, from the concerned field, obviously. So the enormity, which is there, the magnitude, the gravity, which is there, and the serious challenges in this particular sector could be at least scoped to some extent. So one of the most and the foremost challenge that has been there, which is being reported constantly on and on, is the unexpert, unskilled staff, the unskilled manpower. Say, for example, we got the CT scan machine, or we got a dialysis machine, or we got the ultrasonography machine. Now, when somebody who's operating it doesn't know the operating system, he doesn't know the ERP, he doesn't know the software, he doesn't know the data analysis, he doesn't know what input he has to basically feed on the machine, obviously. So then the result that you're getting, obviously, and that you're passing on to the doctor, the test report that you're passing to the doctor is not 100% accurate. There could be the miscalculations, there could be the misinterpretations, there could be the major mistakes in that very much report. And based on which, if we otherwise say, the doctor will not be able to diagnose the proper, the ailment or the disease where from this is coming. And when he is not able to diagnose, he is going to recommend something else. The treatment which was not basically required for the patient, obviously, he is going to recommend that patient. The medication that was not basically required for this patient, he is going to recommend that very, medication. There have been a serious kind of the data that's showing that how our staff is not able to to 100% deal with those kind of machines, to understand these kind of machines, how to operate them, how to get the 100% results which are fully accurate and which are being given to the doctors, obviously, for diagnosing those ailments. That's been one of the serious issue, and that's been one of the critical areas the government has to really think a lot. So government need to really call upon the experts. They need to call upon the teams. They need to call upon those who are, providing these kind of machines, and how the training can be, imparted. Because the central government has been saying that they've been claiming that crores are being spent on the reconstruction and the rebuild and the development of the hospitals in terms of spending the money or investing the money in the training and development programs. So why these training and development programs have not been up to the level where they understand these all the machines, they understand all these kind of equipments? That's been one of the areas the government has to think a lot, and they have to really train the staff. They have to really, grow this, staff at the level where they can really read these machines, scans, dialysis, ultrasound, all these kind of basic machines which are required for the day-to-day treatments of the patients. That's one of the requirements that they need to really think upon, and they have to really groom the staff to the level where they can deliver the best of the results for the doctors. The second major problem is for those areas, or for the people who are living in the far-flung areas, where we are observing the diseases of the cardiology. We are having the reports of the diabetes. Majority of the people facing the diabetes issue, the people with the kidney ailments, the peoples with the neuro issues, the peoples with the skin, obviously kind of diseases. So this has also been one of the major area where the government has really not been able to reach to those outbreak areas, that not been able to develop the hospital infrastructure, develop those, provide those kind of laboratories, those kind of machines, those kind of the amount of doctors, obviously the ration of the doctors that has to be there, the ration of the nurses that has to be there, obviously. So these are the areas which have been prone to, what you call as these kind of dangers. So government has not been able to really focus on these areas, far public areas, especially the bordering districts where we have more than 2 million people over in 5 major districts of, say from Udhampur, you got Reshi, you got Doda, you got Kishtwar, you got the poor peoples obviously cannot afford to travel to summer of the capital or the winter capital for the, what it is treatment of special, you know, the facilities required. So the government has really focused on these areas, obviously, how to improve the standard of the healthcare, how to improve the infrastructure, obviously. Where this money which has been allocated to the government on the central verticals from the budget, on the infrastructure, on development of healthcare facilities, on the recruitment of doctors, recruitment of nurses, on setting up new laboratories, supply of new equipments, new machinery. So there has to be a mechanism where all these areas can be gauged, obviously, in a time-bound manner. In a time-bound manner, there has to has the appraisal system. It has to a feedback system. It has to has the advisories. It has to has a team, obviously, which is going to tell the government and advise the government that so and so has been basically set up. So and so projection was set up. So and so goals were set up. So and so, and what you call as plans were basically, or the funds that were allocated for this purposes have not been achieved. So this is the second area the government has to really think about the far flung areas, why the people are basically suffering in the cardiology, why they are suffering on the kind of kidney diseases, on the neuro issues, on what because many other issues, what it calls diabetes. So a special focus has to be on these areas. That should be the priority number two for the government, obviously, to focus on these areas. One of the grave area, that's the maternity issues. The women that are facing during the pregnancy, obviously, we have had a lack of the maternity faculties for the women, obviously. Now, we are getting the reports from different sources that 15.7% women are unable to have the children without the medical intervention. And around 14% of the women are incapable to conceive the children. Now, these are the figures which are staggering, and the government really need to understand why without medical verticals interventions, or why the women are not able to, because this accounts around 30%, my dear brothers and sisters, and we need to really ponder upon those factors. We need to really understand those factors. We need to really think about those factors. And of course, one of the couple of factors have been via the government's obviously intervention, where the lifestyle obviously changes have resulted in the women has not been able to conceive the children's, or without medical intervention. So these couple of areas where the government really need to think about how to improve the standards of the maternities. Obviously, those women who are having the pregnancies, how the best treatments could be given over there, how the best faculties could be given, how the sub-district hospitals, the gynaes, and the equipment, the staff, the nurses, obviously, who nurture during these, what it was 9 months to those women. There has to be the priorities. There has to be allocation of funds. There has to be an experts. There has to be a feedback. There has to be a mechanism where you're going to gauge this area, obviously, and you'll get the parameters on which you're going to gauge the performance of how this maternity sector has been basically performing. We need to really get inputs, and then based on that, the further projections can be obviously drawn. So this is one of the grey area the government has to think really a lot, and there has to be a policy that need to be framed, that need to be action points required to be obviously implemented in the future in 2025, once the government which comes into the formation, obviously after the results are announced in Jammu and Kashmir, once the conclusion of the three-phase elections takes place in September and October, my dear. We've also seen many of the doctors continue to perform the cesarean section, when it comes to maternities. Obviously, why? For the financial incentives or the financial gains or financial benefits, they encourage the purpose of cesarean, what you call as sections or cesarean surgeries. This is one of the area where the government has to really look, and they have to check, they have to supervise, they need to have the teams, they need to have what you call as obviously a mechanism wherein they will check it and investigate these kind of matters, and because these have consequences post deliveries. Obviously, the women is suffering on many accounts, and the government has not been able to really supervise and bought in the mechanism, bought in the policy, bought in those kind of what you call as uh, points, the protocols where the doctors could have been checked on these accounts as to why, for the financial gains or financial incentives, they are encouraging or they are promoting this culture of the caesarean what it calls births, as this is having a very negative impact on the health of the ladies in the Jammu and Kashmir, more specifically around the country. In India, obviously, this has the impact on the health of the women. So this is one of the grey area that the government has to really think a lot. Now, if we talk about the WHO, they have set up a kind of regulation, the kind of a ratio wherein they said that in Jammu and Kashmir there has to be 1:1,000. One doctor should be deputed for 1,000 patients. But as we are seeing in Jammu and Kashmir, we have 1:2,000 patients. This is the ratio that we have currently in the Jammu and Kashmir. Obviously, one doctor that is there of the ratio of 2,000 peoples. So this is the kind of a staggering amount. This is the area where the government has to really think about. They need to recruit more doctors. They need to bring in more doctors. They need to really take on board the recruitment boards, obviously, as to why this numerous staggering, vacancies which remain unfulfilled, filled, obviously, why there has not been proper grants or proper funds allocated by the central government, obviously, to appoint those doctors, obviously, in these areas, so that this gap, this vacuum could have been really bridged in, and the people are not going to suffer on these accounts as to why these ratios are increasing day in, day out. And it's really something very alarming, and the government has to really focus on this area as well. Now, talking about the beds, we have come to know that only 2,459 oxygen supplied beds are available in the six major hospitals in the Jammu and Kashmir, which is equal to the ratio of one oxygen supplied bed per 1,000 patients. Now, this is also one of the staggering figure that's really giving the impression as to how our state of Jammu and Kashmir is obviously, back on a back foot, on a back track when it comes to the health sector, and that's really posing a serious kind of threats to the health of the people of Jammu and Kashmir. Obviously, the government has to really focus as to more and more, oxygen supplied beds could be supplied to the state of Jammu and Kashmir, and more funds are allocated, and these kind of important essential equipments are being supplied to the Jammu and Kashmir and make them available. And the more number of hospitals which are having the oxygen supplied beds are made available to the state of Jammu and Kashmir. This is also one of the staggering figure that we got from the source, obviously, that the government has to really focus a lot, and they need to allocate the funds on it. They need to really engage the central government, obviously, get more allotment of the funds to invest on the healthcare faculty in the Jammu and Kashmir. Now, you'll be surprised that Khag is one of the area in Budgam district, and there have been reports of inadequate, primary healthcare services. The residents have been saying that more than 34 villages are depending on a one primary healthcare center, which means that more than 60,000 people are depending on the facilities, on the service of this healthcare center. So imagine the magnitude, imagine the irony that why the government has not been able to focus on this Khag village, which is there in the Budgam, obviously. And there have been the reports last time that there are lack of the ambulances also in many of the hospitals. The patients with the emergencies are not able to, who have been referred by the sub-district hospitals to the main medical hospitals in the Srinagar, obviously, not able to reach on time. As a result, there are untimely deaths and loss of the precious lives. So we need to really understand why the proper enough number of ambulances have not been allotted to the tehsils, to districts, to the hospitals, when you get more patients who have been referred, obviously, on and on. So you get more criticality of the patients. So that's been one of the area where the ambulance, number of ambulances need to be increased. There need to be fund allocation for the number of ambulances. And I think government has to really gauge themselves. They have to really think upon this area as to how we can have more ambulances allotted to the hospitals in Jammu and Kashmir, obviously, to really make sure that these kind of incidents does not happen and the people do not die on the way, without reaching to the some of the specialty hospitals in the capital in Jammu and Srinagar. Obviously, has been one of the gray area that the government has to take this a serious note on this as well. So we're going to see you next time with some more stories from the Jammu and Kashmir. Till then, good night. See you.